Hi, I'm Dr. Ryan Dumke. I'm a clinical psychologist serving San Diego and Southern California areas. Psychology is a fascinating subject and something I've always been interested in. But since becoming a psychologist and a therapist, seeing people who have the way I think of it, have just been exiled from their lives through depression, anxiety, trauma, emotional numbness, and seeing them come back from that exile, seeing them re-engage with their lives. And that's been really wonderful for me. That's been something that's driven me. It's interesting when I think about why I do what I do. There's a deep sense of meaning in it. Something I'd hope to help my clients understand. What is meaningful in your life? What kind of values? And when I say values, I mean, what's valuable to you? What gives your life a sense of purpose and meaning? I think when people are initially starting to think about going to therapy or reaching out or starting to look around at different therapists, there's a lot of fear and insecurity, particularly if it's the first time, and the sense of feeling overwhelmed. Often there's a lot of pain, depression, anxiety, fear, what have you, a lot of different things. And it can feel quite overwhelming. I get that. To open up to somebody new, it takes a lot. It takes some strength and willingness to trust. It's funny, you hear so many different ideas about what therapy is, and I think people have a lot of different ideas from movies or TV or from a friend's experience about it. And there's oftentimes a stigma that, it's for people who are weak or who can't hack it or who can't deal with things, or people just have some idea, well, that's what other people do, but not me. It's really no different than if you broke your leg, you'd go to the doctor to get that fixed. If you had a really bad cut, you'd go get that sewn up. If you were sick, you'd go get that taken care of. And if you don't deal with those things, they tend to get worse. I'd encourage people to think about therapy as very similar to that. Hey, I'm going to get checked up. I'm going to get something taken care of. And it can be something that I can use to strengthen myself. The whole point of therapy is to not be in therapy. That way you get to fire me at the end of all of it. There's something we're working on. We're getting to a goal. And we're developing skills that I can use, not just for this, but for the rest of my life and other things. If you're watching this right now and considering starting therapy, I encourage you to reach out. Feel free to book a free phone consultation with me. We'll talk for a little bit. You get to know me a little. Tell me a little bit about what's going on and how it's impacting you and what you're looking for. I'll explain my approach to therapy and what I think might work best as a treatment plan. And you can get a sense of how I work. No pressure. And I'd encourage you to reach out. Give it a chance. Hope to hear from you. All the best.